Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Welcome to another episode of I Am You. If you are new to the podcast, welcome. We are here carrying on conversation with women that have been in a system of healthcare that neglect us and fail to recognize us. Today, our guest is an amazing young woman, Sherry, that has a very fantastic story to share. I invited Sherry today because I want you to see that heart disease doesn't have phase nor age, and that it can affect us at any time. So welcome to the podcast.
Thank you very much. Thanks for having me.
You're welcome. You know, one of the things that I like about carrying on conversations like this with you guys is that, number one, I recognize that it's not easy. No, so normally we don't talk about illnesses. We don't talk about our conditions. We can talk about makeup. We can talk about hair. We can talk about facials and share all the notes that we need to share in there. But when it comes to our diseases, of course, we treat it very privately, not understanding that so many times we can save lives if we can only share some of our journey with some of our friends. And when you come to my podcast, basically what you're doing is saying, I want to share my story. So the women that are listening to us all over, when they hear your story, they can become proactive and become the CEO of their own health. And that's why I'm so grateful that you're here.
Well, thank you.
Okay, so why don't we start with sharing with the audience, how do you ended up in a cardiology office, and how young were you when that happened?
I was 52. I had just ended the school year, so summer had started, and I was just feeling really run down, tired. I was having a lot of heart palpitation, but I just thought it was anxiety, menopause maybe, and ignored it all summer long. And then I kept getting nauseous. And I ended up going to an emergency room with my son just to get like an IV because I kept just getting sick and I just felt really horrible. And when I went in, they immediately took me in, hooked me up to monitors. I'm like, no, I don't have anything like that. And when they hooked me up, alarms started going off that was at 180.
Oh,
and it was,
God.
I didn't know I had AFib. And they said, you know you have AFib? I said, no, I don't. I don't have AFib. And they said, but you do. And they lowered it. I went home. The next morning it came back. So I went back to the ER, and they started running tests. I had a man cardiologist who told me that feeling nauseous was not a symptom. And he did not understand why that was even a part of my history, which we know that you can feel nauseous when you're having AFib. So that's how it started. And a good friend of mine who used you told me that he knew of a woman heart doctor who I told him I thought would be more comfortable with a woman after having a man tell me that, that wasn't a symptom for anyone, but it is. So
yes,
yeah.
Like we are all different, no? So it's
We
very
are.
interesting when people say, no, that's not, it's not uncommon that when as an individual we experience something, and then how can we say, no, that's not a thing? It's like, well, I'm feeling it and it's related to my atrial fibrillation. So therefore, even if it's not a common thing, yes, nauseous can be the only symptom that somebody might have before you discover that there's something wrong with them. But, I want to emphasize a few things for the audience. When you're a very busy woman, so you want to tell the audience what you do?
At the time, I was a reading interventionist at a school, and I also had I have two sons and a husband, and just running the house and, having their health things. And I was not paying attention. I was not paying attention to my health. They would have been fine with me going and taking care of it. I just didn't take the time for myself to do that.
Which is very typical for a woman, no? So you're at school, teaching reading. That's what you said? Yeah? Reading specialist.
I'm a paraprofessional at a school, but yes, I taught intensive reading. Yes,
Okay.
and it was challenging. I loved the job, but It's challenging.
It's challenging. And then, of course, a full-time mom and then a full-time wife. Yes. And who has time to get sick and who has time to get checked? One of the things that that we emphasize here all the time is about how women put themselves in the back burner. And as caregivers, we normally don't prioritize our health. And, looking at somebody like you did end up developing a heart condition early in life, but the importance of you have to make yourself a priority as an act of love for the one that you love. Because like you said, I'm pretty sure that my kids will be okay. Mom, go and get checked, or your husband. But it was on you. It was not that they were imposing that on you. It's that we impose that on ourselves.
Exactly.
That, you got to be there. You want to be there for them and you don't want to be spending time doing something else. I want to go back to when you talk about the summer. That's the reason why I mentioned the work that you do, because for you that meant vacation. It's like, now I'm off, now I'm supposed to be resting and doing my things, but then you started feeling like I don't feel right, and you were blaming your symptoms on menopause. However, before we go on that route, because I think it's super important that we talk about menopause and how the menopause affects women's heart, that's another problem that we have as women, is that we're always blaming it on something. Yes. So we always want to find something that sounds not important or not critical or not life-threatening to justify how we feel, why we feel the way we are. Sometimes fatigue is that, I'm sure I'm overweight. If we are short of breath, we said, I'm out of shape. If we have a little bit of a palpitations, in your case, you're like, it's my menopause. Yes. And although it's true that menopause can present with a lot of all these symptoms that you were describing, we should not be assuming it. We should know. So it's like, okay, wait a second. Yes, this can be my transition through menopause, but is it my transition through menopause? Because we know that menopause is a natural process for women, but we also know that transition is where the risks for cardiovascular diseases grow exponentially. So it's like crossing a portal.
I did not realize that. I did not know that menopause would, maybe kickstart a heart condition that was already there, or...
Yeah, so mostly for us, although we are way behind in time in research and studies to understand menopause and how menopause affects the heart and what can we do to prevent it. We do know clearly, the data says that the risk of heart disease for a woman increases after menopause. So we know that it's like crossing a portal for us. It's like, you're fine. You are protected. That has to do a lot with our hormones. We produce estrogen, which is cardioprotective. So as long as you have enough estrogen in your body, your heart is good. It relaxes well. The arteries are relaxed. There's nothing happening in there. But then once that estrogen levels start going down, and then the heart is the first organ and the organ that get affected the most by menopause, then we start showing up problems. Blood pressure goes up. Cholesterol goes up. We start experiencing palpitations. The heart gets stiff. We start experiencing heart failure, coronary artery disease. So if we think about it, it's important for a woman to understand that what can they do in their perimenopause, which is way before your period goes away, to reduce the risk of having a cardiac event. But in your case, you didn't know. So what would you know to go when you were in your late 40s to start getting checked and said, I'm in perimenopause? And it's very difficult for a lot of women to know when they're in do you know?
No, I was busy. I had my oldest son was having some health issues, and I really wasn't paying attention. He had been in and out of hospitals, so I was not paying attention at all. I think when it started happening, I'm like, oh, okay, this is... you skip periods, you're like, oh, this must be what's happening, because I was not paying attention.
You didn't have time for it.
All. No, I didn't have time for it.
Yes. So for a lot of women, when they are in the perimenopause is more about between the ages of 45 and 51. It's just those few years prior to menopause. And menopause is defined by medical terms, that is a full year without a period. Yes. But way before that happened, your body is already changing. It's not like a switch of a light. It's like there are changes happening way before. And the idea of having this conversation with our women is that recognize that there is a moment in your journey that it will be much easier to prevent your heart disease if only through that perimenopause you identify your risk factors, you go for a good check, and know if there is anything that you can do different to reduce your risk of developing cardiovascular disease. Now, fast forward to your presentation with atrial fibrillation. Atrial fibrillation is a very common arrhythmia problem. In women, it's much more common after menopause. And although it's still more common in men, it presents more symptomatic in women. We tend to be different in terms of when we have it, we are more symptomatic. We cannot live necessarily very easily with that atrial fibrillation.
No.
And interestingly enough, when a woman is in front of a physician when a woman with atrial fibrillation is in front of a physician, they're less likely to receive proper treatment. They're less likely to be offered an ablation. They're less likely to receive antiarrhythmic therapy. So a woman like you who is so functional, so busy, and now all of a sudden is like, I feel terrible.
Really terrible.
I don't feel good. It will be a great opportunity to say, okay, so these are the things that we can do. So I want the audience to know that, if you have been diagnosed with atrial fibrillation, know that there are a lot of things that can be done for you, and more often than not, you're not going to be offered those things. So make sure that you have conversation with your providers about what are my options in terms of treatment. What were your options?
Well, I told you that I did not want to be on medication, but I was on medication. We talked about that, and I ended up having my heart shocked because it just would not do what it was supposed to be doing. I had gone back to school in the fall, and it was really hard. I was having trouble just reading with the kids. My heart rate would go up to 180 for no reason.
That has to be terrible. Not like you're trying to tell somebody to read this and then your heart goes and
then down and then down. So when you offered, you said that there was an ablation that could, change everything. I jumped on it. It never occurred to me not to do it. A lot of people have said, were you scared? That I was like, I was more interested in getting this fixed. I don't really want to have a condition where I can't walk across a parking lot without my heart rate going crazy. So, and now I walk 3 miles every day without my heart doing anything really. So it's great.
So there was options. So there were options. For me, it was very clear when we met, when you told me, can I not take meds? And then I'm like, okay, so for now we are, but we're going to fix this. No. So in the meantime, we just had to do what we had to do to help the heart. But that is great. The fact that you're looking for alternatives. Mm-hmm. So for the audience, it's like, you don't have to take meds, at least have the conversation. It's not that there's no options for you. Now, if your physician had tried everything that we discussed here, cardioversion, antiarrhythmics, rate controlling agents, and ablation, and nothing worked, then perhaps you will have to take medication. But I don't want any woman that is listening to us to feel that anybody tells them it's medications and nothing else. It's like, okay, let's go over this conversation. Can I at least go through an evaluation? No, see an electrophysiologist. Like I normally tell you guys, go through a consultation and see is it that they're going to do, how are they going to do it, and then you can make a decision. But there are options. And if we are saying that currently, in the healthcare system, women are not receiving proper treatment for the atrial fibrillation because they're not being offered the therapies that you receive, then I want the women of our audience to then initiate the conversation. No, so your doctor is not going to initiate the conversation. What about they initiate the conversation and said, I heard this amazing woman on a podcast that says that ablation is an option. And if it's going to give me a good quality of life where I can recover my ability to walk, like you said, no? And also that peace of mind, don't you think that that also is so powerful that you don't have to be worrying about when is this thing's going to...
It started to control. I know that I called you multiple times, what should I do? It's, not going down. It puts you in a panic, I think, sometimes. And the fact that I don't have to do that anymore, and I'm not on any medication except for an aspirin, I love that. It's so healthy. It took a little while to get here, but I feel healthier now than I did when this started.
And when you're going through that journey, it seems like it's never going to end, no? So, like, when you're going through that process, it's like you feel so terrible, and then the ups and downs, and then we're trying this and trying that. But we see the journey, and we said, okay, there's something else that we can offer. And it's so powerful when at the end you're like, I feel so good, and I'm so glad. And I cannot emphasize enough that powerful benefit of the mental reassurance that I'm okay. Now I don't have to be wondering when I'm going to have my next episode, and when I'm going to have the ups and downs again, and when I'm going to feel terrible one more time.
Exactly.
Yep.
And I know if I start to have, symptoms again, that I go to you and we figure this out again, maybe another ablation, or maybe that won't ever happen. But, I do know that it's not the end of the world if it has a little thing that everything's fixable.
Yes,
so,
yes. And I think that's actually super powerful also for the women that are listening. It's like, yes, don't get discouraged. Sometimes we have a little bit of like path that we have to go through, but ultimately there are things that can be done for them. And then I do not want to end the podcast without emphasizing the importance of understanding that menopause increases our risk for heart disease. So if you are going through menopause and you are noticing that you're getting palpitations, do not assume, don't you say? Don't assume that this is just menopause, because like Sherry, it can be an arrhythmia that can cost them their life, but more important, their quality of life, because there's nothing more dreaded by the majority of us than a stroke. Imagine after you're such a young person. If we didn't discover that you have atrial fibrillation and didn't give you the proper treatment, stroke is always a risk. No, so we work very hard. The audience we have a lot of teachers in our audience, and executive, working moms, and we work so hard to end up in bedridden or unable to take care of ourselves because we assume that the palpitations that we were having were just menopause.
It really would have been just, if I had gone on the path without, figuring this out, I would have had a stroke. I really do feel like, because it was so high. But you fixed all that.
But you didn't. Yes,
but
you didn't.
You fixed all that, so that's amazing.
So I'm very grateful that you came here and shared your story. And like you, I do want many, many more women to share their story with their friends and family so they can learn from them. And, let's empower each other to become the CEO of our own health.
Absolutely. Thank you for having me.
You're welcome. And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD, NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.